Hi, I'm Mark Widdowson, and in this short video I'm going to be saying a few words about what psychotherapy is, and then I'm going to say a little about how you can get the most out of therapy sessions. Psychotherapy is a type of therapy which is focused on talking with a specially trained therapist. The words counselling and psychotherapy are often used interchangeably, although in this video I'll use the word therapy to mean both. The therapist will aim to create a confidential and supportive environment where you can discuss your problems, gain a deeper understanding of yourself and your situation in order to help you to resolve problems and improve your overall mental health and well-being. There's an enormous amount of research which has repeatedly demonstrated that therapy is highly effective for a broad range of issues and problems. In addition to a long and rigorous training process about the theory and practice of therapy, therapists have also been trained to be non-judgmental, and you can expect them to be fully accepting of you as a person. They'll help you to explore your thoughts, feelings, and actions, and help you to find your own solutions to your problems. A therapist should be warm, open, and professional, and although therapy is a very supportive experience, a good therapist will challenge you when appropriate. It's different to other relationships, though, in that the therapist aims to be somewhat impartial and objective. The fact that the therapist is exactly outside of your everyday life means that you can say things to them that you perhaps wouldn't discuss anywhere else. The type of conversations you'll have in therapy can be very different to the ones you'd normally have. Therapy sessions are normally once a week and last somewhere between 50 minutes and an hour. The amount of sessions someone can need can vary, although most people have between 6 and 40 sessions, although of course this depends on the nature and severity of someone's problems. However, most people do find that they get what they want out of therapy within around 20 sessions. Not only can therapy help you in reducing symptoms or recover from problems such as depression, anxiety, trauma, and so on, it can help you manage your emotions, develop satisfying relationships, become more at ease with yourself, and help you to improve many different aspects of your life. Now I'm going to give you a few pointers about how you can get the most out of therapy sessions. Although it might seem quite obvious, the therapist can only help you if you turn up on time and come to regular appointments. It's important to have regular appointments to build up a momentum of change and to ensure you have enough support to make changes in your life. A lot of people feel worried that if people know they're having therapy, that people will automatically assume that that means that they're crazy. Actually, most people react positively and are supportive. It isn't unusual for people to find that their friends and family members open up in turn about problems they've had. Occasionally, well-meaning partners, family members or friends try to tell someone what they should discuss in therapy or ask intrusive questions. If this happens, discuss it with your therapist who will help you to explore how you can best deal with it. Generally, therapists rarely give advice about what you should do in any given situation. Instead, therapists aim to provide a space where people can explore their situation and options and choose the best way forward for them. There are lots of different types of therapy available, all of which are slightly different in emphasis. Also, each therapist has their own style or way of working. Often therapists have this information on their website or may have an information leaflet for prospective clients which you may find useful. If you want to know more though, contact the therapist and speak to them about your queries. If the type of therapy or the therapist's or personal style does not seem to be a good fit for you, shop around until you find one that does fit more comfortably for you. Trust your own judgment on this. Change can be hard. Although we often want things to be different, we may struggle with implementing changes in our lives. It might sound obvious, but to get the most out of therapy, you need to put effort into making changes. Making changes will mean putting in some effort and may mean putting in some time each day to do certain activities which will help you to change. There's a lot of research which suggests that clients who put in this time and effort into changing get better outcomes from therapy. If you're only allowed to have a limited number of sessions, you'll get more from them if you make a lot of effort to put the things you've learned in sessions into practice in your everyday life. Some therapists use techniques which can seem a little strange at first, such as visualization, or you might feel self-conscious when you're doing something in a session. The technique will have been specifically chosen to help you with a particular problem, or to make a particular change, or maybe to help you find out more about some aspect of yourself or your situation. It's worth having a go at the technique the therapist suggests and seeing what happens. Therapy can be considered a kind of laboratory where you can try things out or experiment in new ways of thinking, feeling or behaving. Experimenting with new things can be a great use of your time in the session. Sometimes people are concerned that therapy will change them into a horrible person or that it will drastically alter their personality. It won't. Therapy is designed to help you be the best person that you can be. Many people find that writing down the things that they learn in sessions helps them to remember their insights. It's fine for you to pause in a session to write something down if you feel the need to. If you and your therapist discuss a particular course of action, or your therapist suggests a development activity for you, it's a good idea to write it down during the session. Also, it can be useful to spend some time after sessions to write down your overall reflections from the sessions. Most people find that during the week they think about things to discuss in their next therapy session. If this happens to you, make a note of it and make a point of talking about it in the next session. Your therapist will probably ask you lots of questions or may ask you to elaborate on something you've already mentioned. Sometimes these questions can seem a little weird or may mean you have to repeat something you've already told your therapist. In these cases, the therapist is probably following a specific train of thought designed to help you explore something in more depth or to connect to different experiences, so go with the flow and be open to their questions. It's important that you're frank and honest with your therapist. Some people struggle to discuss certain things because they feel embarrassed or concerned that the therapist will think less of them because of it. Experienced therapists will have heard many things in the course of their work, and it's very unlikely that you'll say anything they've not already heard before. Therapists are trained to be non-judgmental and accepting of their clients. Occasionally people feel negative feelings towards their therapist, such as irritation or anger, or towards the therapy process, and may feel like suddenly stopping therapy. If this happens to you, it's important to raise this in your next session. Usually these discussions are very productive and useful. Most people tend to feel a bit awkward or self-conscious in the early sessions, or find that they're reluctant to open up. For therapy to be so effective, you have to be willing to trust your therapist and open up to them. Let yourself be vulnerable in their presence and express your emotions. Don't hold back tears or any of your other emotions just out of embarrassment. Discussing our deepest, darkest thoughts, feelings and experiences can feel painfully embarrassing. That's quite normal. Over time, it will get easier. You just have to be willing to push through your discomfort. If at any time you start to hold back on saying something, tell your therapist that there's something you want to say and that it feels awkward. They'll help you to explore this experience and help you find a way to talk about it that feels manageable. It's a good idea to spend some time before your session thinking about what you want to discuss or what you want to get out of the session. Reflecting on how you're feeling and noticing what feels emotionally biggest in your life right now can help you prepare for your session. One of the most useful things that you can do is to give your therapist regular feedback about how you're finding sessions and tell them what you're finding to be helpful and anything that you find to be unhelpful. So, to summarise, the main points are: be punctual and attend regularly, be open and honest, and put in an effort during and between sessions. You'll find that if you do these things, that you'll probably have a very good experience in therapy and you'll make all the changes that you want to.